According to the World Health Organization, the Africa region carries a disproportionately high share of the global malaria burden. In 2018, 93% of the world's malaria cases were in sub-Saharan Africa. And now, with the advent of the coronavirus pandemic, the world body has warned the region not to neglect existing health programs as they respond to the new viral infection. In the last week of April, Zimbabwe recorded 21 malaria-related deaths and more than 3,000 positive cases.
Currently this year, what we've also witnessed is that there seems to be a huge increase in the number of malaria cases than what we traditionally witness. According to the statistics that we've got from the Ministry of Health, they've said that we've passed over 170,000 cases of malaria as compared to about 110,000 cases last year. And also, sadly, we've also witnessed an increase in the number of deaths from malaria. I think we've had about 60% increase in deaths from malaria this year as compared to last year.
Health officials say Zimbabwe's crippled healthcare systems pose a significant threat to the sufficient rollout of malaria treatment. The country is struggling with adequate resources and medication. The current national lockdown and the movement restrictions are worsening matters.
Most drugs are imported from India, from outside Zimbabwe. So I don't think that we've got enough capacity at the moment to deal with the cases. I think if you even witness what is happening in terms of the deaths in malaria, I think this actually shows how our healthcare system is failing to respond adequately to malaria cases.
The number of new malaria cases continues to rise daily. The highly affected provinces are in the northeast of the country, namely Manicaland, Mashonaland, East and Central. The Health Ministry says they are alert to this new threat and are responding adequately.
We've made sure that we send adequate PPEs to all the outlying areas so that our village health workers can be able to attend to all these people who come up with a fever, which would be either malaria or could be COVID-19. So that is what has happened. So we're making sure that malaria is well looked after, well attended to make sure that we keep our deaths low and people are commenced on appropriate treatment as quickly as possible.
WHO says governments must continue with vaccine and treatment programs and not let COVID-19 distract those processes. Noma Polani, SABC News.